So, as Gillian said, I'm here to talk about consumer engagement, or at least sort of maybe have a bit of discussion about it. There's only really one thing I want to say about consumer engagement, which I wrote on the plane this morning. We only need one potential solution to make a difference. We only need one potential solution to make a difference, and that solution is consumer engagement. However you define it, however you think about it, whatever terminology you use, that is the solution. Consumer engagement, consumers, patients, family, whānau, are the largest untapped resource that we have in the health and disability system. I firmly believe that. They are the largest untapped resource we have in the health and disability system. So today I just want to talk a little bit about consumer engagement and you. So when we talk about consumer engagement, at the Commission we put a stake in the ground. You have to put a stake in the ground because otherwise everyone says, oh no, it doesn't mean that, or oh no, someone else said that, or whatever. You know, everybody's got their own idea about terms to use, and that's fine. That's actually okay. It doesn't really matter. There's no international one term that talks about consumer engagement or patient, family, whānau-centred care or person-centred care or patient-centred care or whatever you want to talk about. But we put a stake in the ground, and when we talk about consumer engagement, we're talking about a process that empowers consumers to help make decisions about their health care. So that's the first thing. It is a process. The second thing we talk about is it works better when there's mutual respect, trust, and active listening. It works better when there's mutual trust, respect, and active listening. And it also works better when systems seek input from consumers and also from clinicians and providers. So those three things make up what we consider to be consumer engagement. I just want to mention, as Gillian said, there has been an opportunity to go around the traps a bit in the last few weeks and do some consumer grand rounds. And there has been a bit of an opportunity to hear what's been going on out there, both from a clinician perspective and a manager perspective, and also from a consumer and patient, family, whānau perspective. So I want to just do a little exercise with you at the moment. Could you all please make sure you've got your shoes on? Feet flat on the floor, please. No singing. And I don't even want to hear, oh God, what do we have to do now? But I just want you to think about the last conversation that you had with a patient or family or whānau. Think about it in your head, or with a colleague, or with anyone recently. I just want you to think about that and listen to that in your head, and I'm going to do the same. So that was 15 seconds. That 15 seconds is what patients, family and whānau are saying about health and disability services at the moment. They are saying that they are not being listened to. They are saying that they're not being listened to, which I find quite remarkable, because it would have to be the cheapest thing that we could do is listen to consumers, patients, family and whānau. What's important to them? What is important to patients, family and whānau? Last week I was in Taranaki and I called into Hawera Hospital, and they had those little speech bubbles for Patient Safety Week. And so I looked at some of them, and the question was on the top of the speech bubble, what's important to me in healthcare? And I just picked 3 random ones out off my phone this morning from a photo. Empathy, respect and kindness. Kindness, looking after people, support and advice and caring staff. That is what apart from the technical skills that you all have in this room, that is what is important to patients, consumers, family and whānau. Let's talk about triangulated data, just for a minute, just to emphasise that point. Last week I was at a diabetes workshop in Wellington, sitting with 50 people who had type 1 diabetes, doing an hour-and-a-half workshop. And I asked them to think about what was important to them and what issues they would like to talk about as a group. So when they came up and presented back as a group and held their bits of paper up, what was on it? What were they concerned about? They weren't being listened to. That was the first thing. And they talked about what that meant for the service that they got. They talked about that at length. I was at the APAC conference a few weeks ago and we had a workshop. Gillian was at that same workshop where we did some filming, both with consumers, patients, family and whānau, and also with health professionals. And we asked them to think about their own personal story, because have you heard the saying, we are all consumers? Who believes that we are all consumers or potential consumers? That's right. That's you in this room. So we wanted to throw that round a bit and test that out with people and say, what does that mean? So what? As a health professional, what does that actually mean? So we did some filming and we came out with some films. We put them up an hour after people had been filmed. And what came out? We're not being listened to. There are taken for granted assumptions about us. Those things were consistent in that triangulation of data there. Consistent messages coming through there. I don't know what that means digging down deeper, really, in some cases. What does that actually translate to? We are not being listened to. So I went and had a look around in some of the work that you've got up there. Mid-central, what we learnt in testing, okay, from the PDSA cycles. Patients in the ward are happy to talk about bowel movements and take it seriously. Patients in the ward are happy to talk about bowel movements and take it seriously. Are you kidding me? Have you ever been constipated? Have you ever been constipated? I know when I had my chemotherapy and got constipated, I said to my partner, I'm constipated. She said, welcome to my world. There was no sympathy there whatsoever. But constipation is a huge issue, obviously, from walking around and looking at some of this information up here. But patients in the ward are happy to talk about bowel movements and take it seriously. Was there a notion that they weren't happy to talk about it? Did people think, is that something that they were, you thought in your role that patients would not be happy to talk about it? So that was quite a revelation. So that opened the door for more conversations that had more meaning, one presumes. Yep. So perhaps we'll hear about that later on, but there is also something about how you talk about it. Yeah. Counties Manukau. Constipation is what the patient says it is. Constipation is what the patient says it is. Counties Manukau, from some of their learners. Is that you down there? No? Up down there. Okay, so these interesting kinds of things coming out that are really directly related to that whole area of consumer engagement. So I just want to ask you to think about finding the consumer in you from your own experience, from that notion of we are all consumers or potential consumers, to find the consumer in you and use that in your interactions and in your dealings with your patients and with family and whānau. Use that experience that you have, but you also have that other balance to make, that other kind of contribution, which is your expertise and your skills and your technical knowledge and your research. Everything that makes, hopefully, healthcare in this country harm-free, and that's what we're aiming for. So I just want to finish up with a poem that I wrote a little while ago, which is actually in this guide for engaging with consumers. Have you seen this? It's kind of like Air New Zealand. Have you seen this? Right. Have you? Have people put your hand up if you have, please? If you haven't seen this, thank you. This was put out by the Commission in June this year. It's called Engaging with Consumers, a guide for district health boards. And so there are lots of New Zealand examples in here about how to engage with consumers and a practical guide. And so it's downloadable from our website, but also if you go info@hqsc, you can get sent a copy. So everything that you need to know about consumer engagement is in this guide. Why are we here? At some time in our lives, most of us will need health care, some more than others, to be fair. Whatever we need, wherever we are, you can be sure, mostly, we don't want to be there. But sometimes we just need care. Look at me, see me, ask me, not why I'm here, but what matters to me this day and this time. I will tell you if I know. If you listen openly, I'll tell you what I know about why I'm here. Will you pay attention and hear what I say? Know who you are and who I am, and who we can both be to help each other with my health care on this day. We are both here. Thank you. There wasn't too many funnies in that, Gillian. You're going to have to do that now. I look forward to the rest of the day and chatting with you and hearing what's going on. Collaborative. Excellent.